do the superior sacroiliac joint, but the whole idea is it's going to be an anterior drive. So what I'm going to do is I'm going to show you guys all three all at the same time, and you're going to choose which one you like, because really it's just a question of how you put your hands. So with Alex, I'm going to demonstrate one, and then somebody will help me out with the other, and somebody will help me out with the other. Okay, so we're going to be lying our patients down in the lateral recumbent position with the fixated side up. Okay, my hands are cold, I'm sorry. So bottom leg is straight, top leg is going to be bent, tucked behind the popliteal fossa. You're just going to hold on to me just for a sec. You're going to twist very gently this way, and you're going to hug and hug. Okay, so the lateral recumbent position, just like we normally do. And stabilize and stabilize. Okay, now this time the contact is going to be, the book says a pisiform contact onto the PSIS. I tend to use the heel of my hand like this and put it on the PSIS. I don't think it really matters so much because truly the drive is anterior, so it doesn't matter if you're using this part or this part. This part gives me a little bit of a more stable contact, but in your book you'll see it's a pisiform contact, and I'm cool with either. Okay. So, generally speaking, it's a pisiform contact onto the PSIS. I tend to use the heel of my hand. What Dr. Dunk does is he twists the hand upward so that the fingers are pointing towards the line of drive. I don't bother. I just do this because I'm going to push this way. Doesn't matter. So Dr. Dunk does this. I do this. Doesn't matter. You're going to do thigh to thigh or knee to knee. Again, it doesn't matter. It just depends on how you feel with your patient. But before you do that, you want to make sure that you have enough torquing room. You want to make sure that your patient's leg is not totally on the table. So I'm going to need you to come a little closer. There we go. And this leg's going to come backwards. Okay. The leg is going to be parallel to the floor with the knee pointing towards the opposite wall, just like we did before. This looks very similar to a lumbar roll, doesn't it? Very similar. The only difference is placement of hand. Okay, we'll do knee to knee, but you can do thigh to thigh, doesn't matter. So, you can use the breath in and out as a relaxation tool, especially for somebody who's keeping themselves stable. You don't have to. If you are going to use the breath in and breath out, on the breath out, that's when you're going to take out the joint slack. That's when you're going to start pushing on the PSIS at the same time as you start bringing your leg down towards the floor if you're doing thigh to thigh, or bringing your knee down if you are using knee to knee. So thigh to thigh, I'm ready to adjust. Or that was knee to knee rather. This is thigh to thigh, I'm ready to adjust. Sorry, I think I already got a little bit of something. All right, okay, so thigh to thigh. We're ready to adjust here. The adjustment is like a lumbar roll, 3 things all at once. It is a quick push into the PSIS anteriorly at the same time as you bow, at the same time as you lunge down on that leg, like the thank you very much that you did. Or if you're doing knee to knee, it's that bow with the push at the same time as you kickstart the motorcycle. However you want to do it, doesn't matter. Breath in, all the way out.